We're up here to talk to everybody today about assessing the impact of the programs that you guys are deploying out in the field. And so our first speaker is Janine Willison, who's a senior research associate at the Urban Institute. She's going to start off by talking about developing a logic model. We assume that, since this is a good place for all of your programs to start, it's also the best place for this panel to start. So.
Well, good morning, everyone. As Jesse said, I'm talking about logic models, understanding and using them, and the critical role that they really play as a foundational step as you think about both program design and readiness for evaluation. So we'll talk a little bit about what are logic models, why should you create and use them, how do you do that, when do you do it. We won't actually talk or spend much time today talking about the mechanics of how you do it, because you can spend a whole session on that alone. So we'll start with the what, the why, when, and whatnot. So as I said, program logic models are really a foundational step in both program design and thinking about readiness for evaluation. If you think about what a logic model is, it's really a visual tool or even a map that provides a clear link between all the different components of your program, including activities to outcomes. So they describe both what's planned in terms of the resources that you're bringing to bear, the key activities or components of your program, and then linking those to the expected results or outcomes. Ideally, logic models are specific and they're detailed, and they're linear, although not always linear, but you hope that there's a linear relationship that you can demonstrate between what you're doing and your outcomes. But they should always, we hope, be logical, that there's a logical link in what you're doing. As I said, they're specific. You want to have details about resources that you're bringing to bear, the planned activities or components of your program, the outputs that you're hoping to achieve, and the outcomes that you're intending to produce. And the major things here, the takeaway that we'll talk a little bit about today, is really thinking about how do you link program activities to desired outcomes? Why are you doing what you're doing? Who are you doing it to? How often? And to what end? So asking those questions, how and why of what you're doing. So why create them? Again, I really liked this quote: knowing where you're headed is critical to picking the best route to getting there. So logic models can help you think through and inform your program design, promote a shared understanding with your stakeholders, others who are at the table. And we'll talk a little bit about the fact that logic models and their design really should be a collaborative and iterative process with your stakeholders. It promotes can help you clarify your program activities and articulate your intended outcomes. And I think also very importantly, as you're thinking about evaluation and moving forward with evaluation of your program, it provides a credible reporting framework. It helps you think about the things that you want to measure, what your outcomes are, and how often you'll measure them. When should you design a logic model? Ideally, at the very beginning when you're thinking about your program and the design of your program. And again, at program implementation as well, but definitely before evaluation, because it is a key tool for evaluation. You can start a logic model really at any time. As I said, doing it at the beginning is ideal because it does provide that roadmap for you. But you can also do a logic model after your program has begun, and that can be a very helpful task as well in thinking through again, the logic of what you're doing. Are your program activities, do they make sense? Are you doing it to the right people? Are there any gaps there? So you can take your logic model and actually use it to look at your actual program operations and see if the program's operating as intended. And then that can help inform any refinements you need to make. And how should they be designed? As I mentioned earlier, ideally you want to do them collaboratively, iteratively, and thoughtfully. Now, collaboratively, you can involve a local evaluator to do your logic model, but we would suggest working with a local evaluator as opposed to handing that off and asking them to do it, because being able to sit down together and really work through your logic model is a great way to better understand your program. And so, as I said earlier, logic models should be specific, and the more specific they are, the better, because it really does help you think through what your the intended linkages are. And so I thought this was a great cartoon. You can see that on either side of the equation here, you have a very detailed equation, and you have two men standing there, and it's very clear that what this part is, and it's very clear what the part at the end is, and in the middle it says, and then a miracle occurs. So it's kind of like you do these things, and then you hope that this thing happens over here, but what happens in the middle? And just need to be more explicit about those particular linkages. So quickly, in thinking about what are the key components of your logic model, there is some variation in logic models, but there are common components, and I'm sure you've seen this even as you've had to put together a logic model for your Second Chance Act application. Inputs are really your resources that you're bringing to bear, how you're going to do something. The activities or the actual work, I like to think of them as maybe the key components of your intervention or your program. You're going to provide counseling or you're going to provide treatment. And then the outputs are the accomplishments, the things that you hope will be produced and you'll be able to track. How many people you placed into treatment, for example, or how many certificates have been awarded. And then the outcomes are really your change measures, the change that you hope will be affected or occur because of the things that you've done. And the logic model is really, if you think about it, it's a big if-then statement in a sense. The idea that if we bring these resources to bear, and if we're able to bring them to bear to deliver these activities or services, then we hope it will produce these outputs and ultimately result in these outcomes. And those outcomes are often, for us, when we're looking at reentry programs, changes in people's behavior. So articulating that and thinking about how all those things line up together. And this is one example of a program logic model for a reentry program. And you can see where this ties together those key components. Now, as I mentioned earlier, there's a little bit of variation sometimes in logic models. We tend to talk about inputs or resources. This logic model actually talks about antecedent factors or background factors, the problem that the program is trying to bring its resources to bear to solve or affect. And so for this program, it's particularly helpful for them to think through, well, what are all the issues that the people we're going to be serving have? And to make sure that they were bringing the right resources to bear and the right interventions to bear to make sure they were addressing those needs of people in order to lead to these different outcomes. Great. And this is a logic model that, again, follows that for a Second Chance Act reentry program. Again, the antecedent factors, just identifying, well, what are the problems that our clients have or the people that we intend to serve? Because most programs are focused on trying to ameliorate some kind of need or problem. And so for this particular program, it was looking at women who had mental health needs and substance abuse needs. There are also, as with many clients in reentry, multiple needs. And so those are all articulated all the way over to the left there. And then you can see the specific interventions of this particular program, both pre-release and post-release, to know if they were covering all those different needs. And then we had intermediate outcomes here, things that may be affected or you hope will be affected by the provision of these services, from increased housing to increased supervision compliance, and then the end outcomes of change that we're all interested in, things like reduced recidivism, reduced offending, and other kinds of compliance measures. And then just one last example where we use a more traditional logic model, again, thinking inputs are about the resources that you're bringing to bear, from partners to staff, to things like risk needs assessment, all that you're going to be able to use. And then the activities, again, which are really the key components of the program and the intervention. And then we had the outputs column where we're looking at, they were very specific in being able to say, if we bring these resources to bear and we have all of these different components, from doing a risk needs assessment to providing assistance with basic needs, we believe that the following things will happen. We'll be able to serve at least 52 women. We'll be able to engage them and their family members in X number of services, to the end outcomes of having reduced recidivism, greater housing stability, and employment retention. So that's an overview of a logic model and how you would use it, and then some resources here for you as well to consider as you think about looking at the logic of your own program.
Okay, thank you. And we're going to have all of the presentations put up on a conference website, so don't feel like you have to scramble to write this down. Our next presentation is from Dr. Christine Lindquist, who's a senior research sociologist at RTI International. She's going to talk to us about establishing eligibility criteria and projecting flow of participants into your programs.
Good morning, everyone. I'm representing two evaluations funded by NIJ. One is the evaluation of adult reentry courts, and the other is an evaluation of adult offender reentry demonstration projects. And I just wanted to mention that for those of you who are particularly interested in the experiences of reentry courts, we have a draft of our Year 2 implementation report up here. I brought copies that I'll be glad to share with you after the presentation. So today I'm going to be focusing on how eligibility criteria and case flow can set your program up for strong evaluation. Basically figuring out who you're going to serve and how many people this will be. And the reason this topic is important, first, it's important to establish eligibility criteria to ensure that you're reaching the target population identified in your logic model. Basically, you want to make sure you're serving the population that you designed your program to serve. Secondly, it's important to have objective criteria that specify exactly who is and who is not eligible for your program. And I'm going to talk in a minute about why you want to avoid cherry picking and why this approach can better set your program up for strong evaluation. And then finally, it's important to be able to document to others exactly who you ended up serving in your program. And this is because if you ever want to replicate, if your program is ever going to be replicated somewhere else, or if you want to bring your program up to scale on a larger basis, you really need to know who you served, because if you ended up showing that your program worked, everyone's going to want to know, okay, but for what population? Because results may differ depending on who it is that's being served. And then, of course, with regard to case flow projections, the reason you want to accurately project how many people you'll be serving is so you can allocate resources and plan staffing and other considerations like that. So I'm sure most of you are familiar with this, but eligibility criteria are basically how you operationalize your target population. And I've listed some common examples of eligibility criteria used in reentry programs. And then in addition, programs often apply exclusion criteria, which are additional considerations that might keep someone who's otherwise eligible from being eligible for your program. I wanted to highlight a few considerations that you should consider when establishing eligibility criteria, and once again, this is with the focus for setting your program up for strong evaluation. So as I mentioned earlier, you want to make sure that your eligibility criteria are designed to reach the population that you intended to serve when you were designing your program. That's really important. Secondly, for grant-funded programs or those who have other external constraints, you want to make sure that your eligibility criteria are consistent with any requirements that are imposed upon you. So make sure you understand what those requirements are, and especially understanding them early in the process is really critical so that you don't end up having to change your eligibility criteria after you've already implemented your program. As I mentioned earlier, it's important to use objective eligibility criteria as opposed to subjective criteria. So the reason for this is because objective criteria can be adhered to more consistently than subjective criteria. So if you have multiple staff who are involved with screening people for your program, identifying people for the program, if you're accepting referrals, if you have staff turnover, for all those reasons, you want to have objective criteria that anyone could follow as opposed to sort of handpicking people based on subjective factors. If you do end up handpicking, and I'm calling this cherry picking because it's often people wanting to pick those who are the most motivated to receive services, or those who are maybe referred to the program by someone who's very influential, that will not work in the long term when it comes to bringing a program to scale or to replicating it elsewhere, because you never really have good documentation about who it was that your program actually served, and so therefore you won't know if your program effects you won't know which population your program effects actually apply to. And then finally, objective criteria better lend themselves to evaluation. And the reason for this is that when you're looking at whether your program works, well, to answer that question, you have to compare it to something. And this is what Akiva is going to focus on in a minute. And so that requires a comparison group that looks very similar to those who received your program. And if you have objective eligibility criteria, you can apply those to a comparison group and end up with people who look very similar to those who were served by your program. Whereas if you use sort of subjective cherry picking, it's going to be very difficult to identify a truly strong comparison group. A few other considerations. I realize this first one may not be feasible everywhere, but it's very helpful for evaluation purposes and for projecting case flow, which I'll talk about in just a second, if you can actually determine eligibility using available administrative data. And these are data elements that are available for everyone, say in the correctional facility that you're going to be targeting, or everyone in the population that you're going to be targeting. If you can use existing administrative data available for that entire population, rather than using sort of interviews or intensive screening forms, it's preferable to be able to use the administrative data. Also, when you're finalizing your eligibility criteria, early on in the process, you should look at available data to project how many people will likely meet your criteria, because at the end of the day, when you go to implement your program, you want to make sure you have plenty of people to serve. And that brings me to the final point, and this is really the most important point I wanted to make during this presentation. For evaluation purposes, it's far better to have a large pool of individuals who are eligible for your program, even if you cannot serve everyone who meets those criteria. So importantly, I wanted to highlight the fact that you shouldn't make eligibility criteria too restrictive just because you can only serve a small number of people. Now, there may be reasons why you do want to have restrictive eligibility criteria, and this once again relates to your logic model, and it relates to the population you're trying to serve. If you truly are serving a very narrow population that has a specific service need that your program is built around, then that's fine. But it's important not to create restrictive eligibility criteria just because you don't want to be in the position of not serving everyone who meets your eligibility criteria. And there are a lot of opportunities for handling these surplus cases. So basically, surplus cases are those who meet your eligibility criteria but who cannot be served due to limited program capacity. I just wanted to highlight that this is actually a really good opportunity for strong evaluation. And when you make these decisions about how to handle surplus cases, it'll vary depending on whether your program is mandatory or voluntary. And evaluation can accommodate either of those scenarios, but you'll implement different procedures differently based on whether your program is mandatory or voluntary. So for example, the best option for handling cases who meet your eligibility criteria but cannot be served would be random assignment. And here you would basically identify people who are eligible for your program, and you would randomly assign some, and it doesn't have to be half, but you would assign some proportion to receive the program and the remaining individuals to serve as your control group. Now, this can work for either mandatory programs or voluntary programs. For mandatory programs, as you identify people who are eligible, at that point you would go ahead and assign some to get the program and others to receive treatment as usual. But if your program is voluntary, you would do this a little bit differently. Basically, when you're recruiting people for your program, once they sign up or fill out the application, whatever strategy you use to have people express interest in participating, you would need to let them know up front that not everyone is going to end up being selected for the program, and that some of them may receive standard practice instead of the program. And of those who volunteer, you would then implement random assignment at that stage. And then the other option, and these are options for sort of building in a really strong comparison design as you're enrolling people for your program. Akiva's going to talk about some other strategies for identifying a comparison group that don't necessarily have to be built into your program's recruitment process. But another option I wanted to highlight, because it works really well in reentry programs, is a waitlist design. And in this type of design, you know you can't serve everyone, so you go ahead and enroll the people that you can serve right away, and you can put the others on a wait list. And what happens with reentry programs is that, if someone does end up if you have a slot for someone and they end up getting enrolled, then that's great. They would move into your treatment group. But oftentimes people get transferred or they get released before they ever get pulled off the wait list. And that can provide a really good opportunity for a natural wait list that can be a strong comparison design. Just a couple minutes about, is that for me? Okay. Just a couple minutes about case flow. This is how many people you enroll in your program, and it's really important to come up with case flow projections that are as accurate as possible. And I just wanted to mention that I realize all of you who are implementing programs have a limited set of resources, and you have to make decisions about how many people you're going to serve and how intensively you serve them, and there's sort of a trade-off there. And I just wanted to mention that for evaluation purposes, it's usually better to serve a large number of people modestly, and I don't mean a large number of people that get basically basically nothing, but a modest set of services, that's usually preferable than serving a tiny number of people and serving them incredibly intensively. You can identify that will work. I mean, you can identify program effects with the latter, but you'd have to have really large differences in outcomes between your treatment and comparison groups, and you would probably need to detect that through a really tightly controlled random assignment design. So typically it's better to serve a large number of people and serve them modestly. And then I just wanted to mention that when projecting case flow, you'll want to use available administrative data, although we recognize that these data are often limited. And in terms of the best way to go about this, one consideration is to start with looking at release cohorts. So if you're intending to serve people released from a specific number of facilities, then you would want to calculate how many people have actually been released from those facilities within, say, the past 6 months, and then use available data to figure out how many of those people actually released would have met your eligibility criteria. And that's some indication of how many people you might find available to be enrolled in your program on a monthly basis. And that's typically how most reentry programs work. You're usually enrolling people on a monthly basis. And then, of course, if your program is voluntary, you would have to factor in the fact that not everyone who's eligible is going to agree to be in the program. And then there are other factors that could influence case flow as well. So I realize this is a very difficult process, but it's important to try to project case flow as accurately as possible using available administrative data. And then the final take-home message I wanted to leave you with is that based on our experience evaluating many reentry programs over the years, it's typically the scenario that programs end up serving far fewer people than they think they will, and this is often because eligibility criteria are fairly restrictive. So this is another reason why it's preferable not to establish overly restrictive eligibility criteria, because programs often struggle in the end with finding enough people who are eligible for their programs.
Okay, thanks. And so our next speaker is Dr. Ron D'Amico, the president of the Social Policy Research Association, who's going to talk about, after you get these participants into your program, how do you track them through the program and after exit?
Thank you very much. Good morning, everyone. I'm glad to be here, be a part of this great conference. I'm going to pick up just where Christine left off. It's really, she was talking about the importance of establishing an eligibility pool. The next step in the process is determining who in that pool becomes a participant and who is part of the business as usual model. Now, this is really a critical decision for evaluation purposes, because you really need to firmly understand who is a participant and who is in that group that's receiving the business as usual approach that Akiva will talk about a little bit later. And that is also important, as we show here. Just knowing who your participants are is important for, first off, for meeting reporting requirements. You'll need to report to your funders that want to know at the very least how many participants you are serving in your program, so you need to track the number of participants for that reason. Secondly, it's important for good program management purposes. Chris mentioned you want to, as you establish your eligibility criteria and project what your case flow will be, you'll need to understand and manage what your capacity is to serve and make sure you're managing your case flow so that you have the capacity to serve those you enroll. So monitoring and being very mindful of who is an active participant in your program is very important from that point of view. You also want to provide good services to the people you're serving. So that means you need to be very mindful of who is an active participant in your program. They're the ones that you're responsible for. You need to do your best to meet their needs, and so you obviously need to have a good understanding of who those people are, how to reach them, and what the next step in their service plan might be. And then finally, as I just touched on a moment ago, conducting a meaningful impact evaluation. You're typically going to be comparing your treatment group participants, those who are in your program, with others who are in the comparison group, getting a business as usual approach. And so that's, again, makes it very important to understand who is a participant and who isn't. Now, it sounds like a very mundane topic, but it actually isn't so mundane, because people come in, the customer flow can be somewhat ambiguous about when a person actually should be determined to be a participant. Some people will fill out applications, be accepted into the program, and they may not show up and receive services. So do you count those as a participant or not? So it's extremely important to decide when you're going to, whom you're going to enroll. First off, you have your eligibility pool. As Chris mentioned, your pool might be larger than you actually have the capacity to serve. So you need to establish some way of determining who is going to get into your program at a given point in time. There could be priority of need. If you're using risk assessments, you might have as an eligibility criteria high or medium risk into your program, and if you find that you have more applicants or more eligible individuals than you have capacity to serve, you might have established entrance into the program based on level of need, based on risk factors, so that you're enrolling those most in need of your program services. There's also something about suitability for the program, and I don't mean this as creaming, although it could be taken that way, but I'm not talking about creaming. I attended a session yesterday about evidence-based programming, and the important point of that program was making sure the mix of services you have fits what the individuals who are entering your program, what their needs are. We work with, we're conducting a random assignment evaluation of Second Chance Act grantees. We're also doing a separate study of a random assignment study of a reentry program run by 24 community-based organizations. And they're very small organizations. They're very mindful of what their strengths are and what their capacity to serve is. And they know what they're very good at delivering in terms of services. And they'll be very frank and recognize when they assess someone and get a good sense of what their needs are, that they're not well equipped to meet those needs, and they'll send them elsewhere into the community. So suitability for the program might be another factor you would take into account. You might use a volunteer process. As Chris mentioned, some of these programs are not mandatory, they're voluntary, and so that's another way you select in and order on a wait list. So those are some of the factors about whom do you enroll. The next step in the process is when to enroll. So again, when does someone cross the line between being an applicant, an eligible applicant, and a participant? And it's very important to have a clear demarcation point. At this point, they're just an eligible applicant. At this point, at a point later, they become a participant. You need to clearly define when that point is. It could be that they've submitted an application and you've reviewed their application, you've accepted their application, you see that they meet the eligibility criteria, and you notify them that they're accepted into the program and they become a participant in that point. That's one strategy you might follow. Alternatively, are they touched by something that you fund, that your program dollars fund? And that might be another decision rule you'll use. Now, I'll give you an example to show the hazards of that approach, and also the importance of a strong logic model that we heard about earlier. We worked, as I mentioned, with some Second Chance Act adult demonstration grantees that received earlier rounds of funding. And one thing we've seen a few of those programs do is they basically spread their funds around very broadly. They take the business as usual model and they just add a few more dollars to the various types of the vast array of services that they were previously providing. And so the problem with that approach is, first off, the logic model is not very clear. What is the Second Chance program? How does it differ from the business as usual model? Is very hard to define. It's not clear what Second Chance is and how it's different from what came before. The second problem is, from evaluation standpoint, if you're trying to identify a comparison group, it's very hard to say, well, who are we going to count as a participant? Because all these different resources in the community that receive their funding, the funding they receive from Second Chance just might make up a minuscule portion of the total dollars they're working with. Do we want to count all those people as Second Chance Act participants? And so that's the hazard of of spreading not being clear about what your program model is and spreading the dollars around too thinly. Or you could say someone becomes a participant when they receive a specified specific service. They receive that first service, after the eligibility assessment, they come in for that first appointment and begin the service plan that you've established for them. So the point is that there are various times along that customer flow path that you could use to establish for when a customer becomes a participant. And there are pros and cons to setting the point of entrance into the program earlier versus later. But it's very important to be very clear what that point is, so that all of your your caseworkers or whoever's serving your program participants, they're very clear about when a person has become a participant and is counted as part of the participant pool. And as I mentioned, there are trade-offs. If you put the point of entrance into the program too early, you have a very low bar for what constitutes participation. Say someone submitted an application and you've accepted that application. The plus of that is you have large numbers to show your funder that you're serving, hundreds or thousands of people. It's just what a great successful program you are, because you're serving so many people. The downside of that approach is many of these people don't show up for service, or they drop out they're not really interested in program services, and they don't really follow through with a service plan that you've established for them. And it's obviously, if you're trying to estimate impacts using a comparison group design, you have a lot of people in your participant pool that are not receiving much, if anything, from your program. And that brings me to this point, that once enrolled, you're always enrolled. Once you become a participant, there's no backing that person out. If you want to have a rigorous evaluation, you have to have this clear point of demarcation for when someone becomes a participant. And then they're a participant in your program, and they are your responsibility, first off, to serve, of course, but also to track. You need to track their services, their outcomes, and so on. And there are no exceptions. Once someone becomes a participant, you can't back them out because they didn't show up, because they're a dropout or a triter, because you can't find them anymore, you don't know where they are, what happened to them, or because they're unsuccessful, because they didn't complete the program of services you planned. The point is, you can't calculate program impacts based on just successful program participants, just on those who do good in your program. And that would undermine the integrity of what you're trying to do if you're trying to calculate impacts. So once a participant, always a participant. Another point is you might want to, for purposes of monitoring customer flow, determine a point of program exit. So again, you still count them in your participant pool for purposes of estimating impacts. But you might want to have a clear point for when someone exits your program, they're not on the active caseload anymore. And it could be that they successfully completed the services you have, or if it's a voluntary program, they say, I don't want to come anymore. And so at that point, you move them from the active caseload portion of your files to a former participant who's exited your program. And that, again, helps you manage customer flow so that you know what the caseloads of your caseworkers are among active, their active cases that they're managing. The point is, you need, everyone who's a participant is your responsibility to track, and you need a good tracking system. You need to track identifying information first off. So if you're a Department of Corrections, that might be something that comes without any difficulty. But if you're another organization, and as we'll hear in just a moment, you want to get recidivism data from a Department of Corrections or the criminal justice system, you need to know some identifying information like prisoner ID and so on. So you need to make sure that's part of your files. You need to measure their characteristics at intake so that you know the characteristics of those people that you served. and you hopefully can relate those characteristics to what the estimated impacts were. You need to track services that they received, ideally not just from your program, but any other agency they might have received services from. So if you make a referral to someone, one of your participants, to some other agency to provide some service, ideally you should have an agreement with that agency that, you know, your job's not done just because you referred them out. You really need to check, have that agency tell you, did the person report? What services did they get? And make that part of your database as well. And then you'll need to track outcomes, which Pam will talk about in a good bit more detail. So I'll end there. Thank you very much, and there's my contact information if anyone has questions.
Okay, thanks. And so our next presentation is on tracking services and outcomes with Dr. Pam Lattimore, who's the director of the Center for Justice, Safety, and Resilience at RTI International.
Great, thank you. I'm going to talk about something that's near and dear to my heart, which is measurement. And first, before we talk about though, I want to provide you a quote. It's one of my favorite things, the summary of which is at the bottom, which is that not everything that's counted, or not everything that can be counted counts, and not everything that counts can be counted. And I think that it's always important to keep that in mind. So I want to talk briefly about why we measure, and then talk a little bit about what to measure, in particular focusing on outcomes, and even more particularly focusing on recidivism as an outcome. Obviously, when you do evaluations, everyone understands why we're talking about measurement and why we're measuring things. I mean, the goal is to understand the effects of the intervention, program, or activity that's under study, and see what the results are for the individuals who participate in the program. So it's critical to evaluation to answer and address the question of, does this, whatever this is, work? But I want to underscore how important measurement is for operations too. Even in the absence of evaluation or research, it's critical for people to understand what it is they're actually doing. You know, what are they doing? How does that compare to the logic model Janine talked about in terms of reaching the individuals that you intended to reach, providing the services that you anticipate that you're supposed to be providing, and to the extent it's possible to understand, measuring how well you're doing. Because it's only by measuring how well you're doing, the number of people that you serve, that you're going to be able to improve your operations year to year, that you're going to be able to get better outcomes, you're going to be able to reach more people, you're going to be able to be more efficient at what you're doing. So I know that oftentimes, I mean, I've been doing this a long time, and it's like, here come the evaluators, and now we're going to have to collect all these data, and oh, woe was us. But even in the absence of that, I think it's really critical for people who are actually doing the hard work on the ground to understand how critical identifying the appropriate measures and collecting the right kinds of data are to just doing what you're doing better. And so in addition to outcomes, of course, I've already mentioned, we want to understand for whom the program works. We've talked about identifying eligibles. We've talked about case flow. Clearly, measuring those things is important to your operations. And then, again, understanding what clients received, what services, what treatments. This is particularly hard and particularly important for reentry type programs where the goal is to meet a variety of needs with services that may be provided by a variety of different agencies. The task to assimilate those data can be quite difficult, and unfortunately we don't have very long today to get into the details, but I do want to reflect that that can be very hard to do. Back to the logic model. My logic model is a little simpler than the ones Janine put up there. We can consider this a simplified version that sort of summarizes inputs, throughputs, outputs to get to the thing that I'm going to focus on, which is the outcomes. And the primary outcomes that are listed here are the ones that were that are reflected in some of the solicitations that you've responded to over the years. But the key outcome for reentry type programs for correctional populations is, of course, reducing recidivism and therefore improving public safety. And then we're also interested in the auxiliary or intermediate or perhaps concurrent outcomes. It's not clear to me exactly where those fall on the continuum there, but outcomes related to employment, housing, child support, and things like that, education, and so forth. I'm going to focus on recidivism because it's something I've been studying for 30 years. It's the most important outcome measure for the grants that you have received. It's something that on the one hand sounds quite simple. The definition is very short, as you see here on the screen, and it's something that is quite difficult to study, not least of which is that we can't observe it. When recidivism is defined as a return to criminal behavior, this is something that we cannot yet anyway observe because we're not yet tracking 24/7 what everyone engages in. And I would argue even if we were doing that, we probably still couldn't do this exactly. There are multiple measures that are observable. All of these observable measures are just proxies for the construct that we're interested in, and they're all subject to error. And again, I'm going to focus on recidivism because we have a short time here, but I want you to take away from this both hopefully a little bit of thinking about what recidivism is, but to reflect about how the complexity of this apparently simple measure really applies to many of the things that we're talking about. If you're talking about housing, housing is not just one thing. It has temporal dimensions, it has quality dimensions, it has self-supporting dimensions, it has multiple dimensions, and so I want you to keep that in mind when you develop your measures. There are a number of common measures that we use when we look at recidivism. We talk about new crimes committed. Generally, that comes from self-report data. I'm not really going to talk about that today. We've got rearrest, prosecution, conviction, incarceration, as well as violations. To get these data, we're going to turn to official records often. Arrest data we get from police reports. These have pros and cons with respect to level of proof. Next in the sort of the chain of processing is prosecution. We would expect that those cases are more likely to reflect true criminal behavior as well as conviction. But conviction data are hard to get. They come from courts. In some places now it's a little bit easier to get those data, but we often rely on the recidivism data that are the easiest to get, which are data from departments of correction, which are only going to include reincarcerations at the state level, maybe probation. They're going to include not only new criminal activity, but also violation activity. And except for a few exceptions where you have integrated jail and prison systems, they're not going to include jail sentences. But once you even measure that, there are other considerations: offense type, offense seriousness, timing and frequency. How do we take those things into account when we're thinking about recidivism? If you have someone who's been engaged in drug trafficking and he gets picked up for shoplifting, has his criminal behavior improved? Probably one would say that, but if you have a simple 0-1 indicator of was the guy arrested, it wouldn't be reflected in that. The other outcome measures, of course, we're interested in are increased participation in services, reduced drug use, improved employment, improved education, reducing violations, increasing payments of child support, increasing housing opportunities, a whole variety of outcomes that the services and treatments that you provide address, and finding these outcome measures can be even more difficult than finding recidivism measures. Other things to think about are the client characteristics. This helps you address the points that were made earlier about who are you serving, to make sure that you understand who your population is and whether they match your target population, and will help you understand for whom your programs are doing well. The other things here are the services. Reentry programs are intended to meet multiple needs. They're listed here. Assessment, you're all familiar with the things that you're being called upon to do, and often these are provided not by you but by someone else, which raises questions about where you will get the data from. Acquiring data, often a grantee may have access only to your own data. What does this mean? Sometimes it means that you count as your outcomes the things that you can observe. If you're a jail-based program, jails-based program success as nobody coming back to prison. So if you're the person that you release, ends up in the state prison, it's a success for you because he didn't come back to your jail. Vice versa, if someone ends up in jail in Pennsylvania for 2 years because they got arrested and charged with something that didn't send them to the prison, to the Pennsylvania Department of Corrections prison system, they're a success for Pennsylvania because they haven't come back to Pennsylvania prisons, but they're certainly not what we would normally consider a success in terms of criminal outcomes. And then if you are, a behavioral health services organization that is engaged in providing reentry programs, oftentimes you might consider program completion to be a sign of success, regardless of whether or not the individual has been incarcerated. The reason you do that, of course, is you're counting what you have. You're counting the data that you have and what's accessible. And, that's okay. It's certainly better than not counting what you're looking at all, but it's okay as long as the limitations of these measures are understood. And then when you form your partnerships and your task forces to start setting up these programs, it's probably useful in those initial talking stages to discuss data exchange. And to try to understand whether it's possible for you to exchange data, for you to establish an integrated database of some sort where you can track your program participants across multiple agencies and domain areas. So I'm going to conclude that there with the quote that I started. And I think that I would add to this that just because you count something doesn't mean that you should, but if you do count it, you're probably going to get more of it. And I think we see that sometimes in our school systems today where people are measuring the things that are easy to measure, whether they're important or not. So that's good. Thank you.
Okay, thanks. And our last speaker is Dr. Akiva Lieberman, who's a senior fellow at the Urban Institute. Is going to talk about assessing the impact of programs, and then we'll wrap up with a couple questions if anybody has any.
Good morning. I'm pleased to be here, but I realize that I am the 5th evaluator in a row on the 2nd plenary in a row at the morning of the 3rd day of the conference. So to get things going a little, I just thought what I really want to do is to get you to think a little bit about the way evaluators concerned with outcomes think. And so I'm going to ask the panel, who has not been prepared for this, I'm going to ask the panel to join me in repeating a mantra, very simple mantra, and those of you who want to think like evaluators, just repeat this mantra with me in a minute. So the question's always going to be, does this program work? And the answer from an evaluator is always going to be, compared to what? Everyone? Compared to what? And it turns out that the answer to that question makes a huge difference. So that's what we're talking about. So first of all, what does it mean to say it works? And a critical point here is that to evaluators, that means, does it make things better, marginally better? That's not the way we usually think about whether or not the cardiac surgery that you had worked. That's whether it actually lived. Whether you lived a few days longer than you would have otherwise, we could debate whether that's working. But that's what an evaluator means. Is it better? Did it improve the outcomes? And which outcomes? Of course, they should come from the logic model, and Pam spoke about that at length. So, compared to what? I'm going to give you we're going to go through just 3 possibilities. But the important point is that different comparisons answer different questions. So, one comparison might be compared to nothing. So the blue circle there represents the program. That little teeny dot that's orange on my screen is the alternative. And if that's what you have, then you're asking, is the program as a whole better than nothing at all? So that would be in the context of reentry, asking if the reentry program is better than release without any pre or post-release planning or services. Is that realistic in your case? I don't know. Whether that's a reasonable question, you might say the answer is obvious. Of course that's better. Well, maybe, maybe not. That depends on whether you think the program has some possibility of doing harm. And in the context of reentry programming, for example, sometimes there's the possibility that continued involvement with the justice system for the sake of helping people actually may do more harm than good. Is that a possibility in your case? I don't know. But if that's what you want to evaluate, you want to know if the program as a whole is better than nothing at all, the only way you're going to find that out is if you have a comparison, which is nothing at all. Okay, another answer compared to standard practice. Here, the program again is represented by the blue circle. Standard practice is this fuzzy bordered orange thing. And so and implicitly, some of the speakers assume that that's what we would be doing in an evaluation. But business as usual is not usually very well defined. So if that's what you're going to do, it becomes really important to understand and document and research what business as usual is. Otherwise, even if you find out the program has better outcomes, you really don't know what that means. What changed? Now, I don't know if you can see, can you see the light blue circle behind the orange cloud? Yes? Okay, good. So in this case, we also are asked, we're saying, is the program simply something added on to standard practice? And so it's supposed to be, the program itself, the blue program, is circumscribing standard practice. It's standard practice plus some other things. One problem with this, of course, is if you want to generalize and places have different business as usual, then whether or not your findings will generalize is an open question. But often what happens is the program is a change from standard practice that is a little different than that. Now you see that the standard practice and the program overlap, but not completely in either direction. So the program has new components, but it also has removed some components of what business as usual is. In that context, it's even harder to know what to make of the findings if you don't really do a serious job documenting what business as usual is. So that's the case here, where some of the business as usual practices are not part of the program. You're betting that the new things that are added are better than what is removed. Is that the question you want to ask? I don't know, but that's what you will be doing. And if you do that, you have to always say to yourself, could any differences in the outcomes be due to removing some of the bad components, if there were any? Nonetheless, this might be quite useful for comparing two alternative reentry models, especially if they're at the same cost. I want to know which one's better. They have overlapping components, but I want to make a choice. And then a third possibility is that you're comparing the program to the same practices, but without, beforehand, there were some essential program components missing. So what you've done in your program is added employment training that wasn't there. There wasn't any employment training before. Now you've added employment training. There wasn't any substance abuse treatment, or there wasn't any co-occurring disorder treatment. That's what you've added. And then what you're testing is simply the addition of those components. That makes it much cleaner to understand what the results mean in the end. Do these key program components improve outcomes? The upshot here is that with different comparisons, the program being tested is different. Now I just want to make one other large point. The rest of my slides will be about this, which is what do we want from a good comparison group? We want three things, essentially. We want the non-program elements to be equivalent. For example, we want equivalent supervision requirements in the program group and in any comparison group we might choose. We want the program elements to differ. We don't want a comparison group who is receiving the same services with either different funding or a different name. And we want otherwise equivalent outcomes for the participants. For example, we want the comparison group to be in a place where the arrest practices are the same as if we're going to use arrests as the outcome, as a recidivism outcome. So if you apply this to a few possible designs, random assignment meets all those criteria. So I just throw that up there. It has the non-program elements are equivalent, the program elements are different, and the people are otherwise equivalent, and they're going to have otherwise equivalent outcomes. Another possible design is a contemporaneous geographic comparison. You look for another jurisdiction that you want to use as your comparison. So then you have to ask yourself some questions. Are the non-program elements equivalent in the other place? The things that you don't consider part of the program, that's not what you want to evaluate, are they actually the same in both jurisdictions? On the other hand, are the program elements that you do want to evaluate actually different? Is the other jurisdiction not providing those? And then, of course, do you have reason to believe that the outcomes would be equivalent without the program in these two jurisdictions? For example, are the arrest practices similar? Another design might be a historical comparison in the same jurisdiction. You look at folks who were released in the year before the program started up, and you compare them to the folks who got released while the program was ongoing, and then you have to ask yourself the same questions. Are non-program elements equivalent? Or is it possible that there's other reentry practices that have changed? Are the program elements different? You've got the grant, you're doing the program. Is it really new practices, or is it funding things that were being funded some other way? You had a different grant from somewhere else beforehand. And then would the outcomes otherwise be equivalent? This is particularly important these days, as we see that in many places crime rates and other measures of recidivism have been dropping. So if those things are dropping, you don't take that into account, you're assuming that they would be the same when maybe they wouldn't be. And the third one I'll mention is you might be looking at a contemporaneous comparison of youth who aren't being served by the program. This is very common. And you have to ask, again, are the non-program elements for that comparison population the same as for the program comparison? Do they have similar needs? Are they similar in all kinds of ways? And are they participating in other programs? And are the program elements different? Well, that you know in this case. And then the third one that bedevils a lot of this is, are the outcomes otherwise equivalent? Would you expect that the program group would show whatever your outcomes are, recidivism usually, at the same rate as the program group? So those are just a few. We could go on and on and on. But the important point is you want one thing to be different, and that's what you're evaluating, what you consider to be the program. You want everything else to be the same. Okay, with that, thank you very much.
Okay, so we actually have a couple minutes left, and there's a microphone right there in the center of the room. If anybody has any questions, I'd suggest this is a good time to get everyone's attention. And while you're all clamoring to get up to the microphone, I'd like to plug in Chesapeake J, starting at 11:15, some breakout sessions for grantees meeting with evaluators. I'm not sure where Chesapeake J is, but it is not here. So you have 15 minutes to get over there. Anybody have any good questions, or questions you think are bad questions? Because I promise everybody else is going to want to know the answer to your question. All right, well then I'll ask a question. So I guess, you know, as folks are walking out of here, what's the one takeaway that you think that would be the most important thing that you've noticed isn't happening in the sites you're evaluating, that if they could just implement that, you know, that we'd move a lot of these evaluations a lot further down the field? And since we all have like 1 minute, I'm sure this is going to be a comprehensive answer. Anybody? Just the one takeaway message that you wish folks would walk out of here, just based on the evaluations you guys have been doing over the past year of these programs?
I'll take the first crack, and I feel like this is a theme that we've heard articulated by several of the speakers. You know, I think the important point that Akiva made is compared to what I think is really critical. And so it must be very clear how your program is different from what you want to compare it to. Typically, it's not typically practical to compare to no treatment at all, because everyone can access services in their communities to some degree. So what is it? You have to understand how your program differs from what you're comparing it to if you want to have a meaningful impact. And following the logic model, it should be clear what that is. And based on your eligibility pool, you need to compare to people who have similar characteristics, and you must clearly define who is a participant and who isn't.
Okay, thanks. And I see we have somebody waiting at the mic. Go ahead.
Yes, good morning. My name is James Lindsay. I'm from Washington, D.C. My question is more of a generic question and especially for smaller community-based organizations. What is the level of effort to encourage Bureau of Prisons, Corrections, and those types of agencies to share data with their local community agencies? I think we've seen a lot of stuff around what we should be looking at, criminogenic needs, all these different things. And as a community organizations, if I have to buy a risk assessment or something that's very expensive, it doesn't lend that type of data to allow me to make eligibility determinations, those types of things. So, I know you guys don't represent those agencies, but to what extent do you think that that's critical, and how can we encourage that type of seamless integration of data into smaller, state-level agencies may have access, but other organizations who have boots on the ground, who are really doing the work, don't have that type of access?
Go ahead.
I wanted to make a recommendation based on what I've seen with one of our reentry court sites, which is Delaware. I know what you're describing is a problem in many places, especially community-based organizations getting available data from DOCs. And I think what they've done in Delaware as part of a statewide reentry initiative is they have an MOU set up with the state and then all the service providers, and part of what makes that happen is that individuals who enroll in this statewide reentry initiative sign a consent form that entails the release of information to all the partner agencies that are part of this initiative, and I think that's what helps them share information with all of the service providers, and there are confidentiality measures in place.
Okay, go ahead.
I have a question. I love the question about is the program working compared to what? So as evaluators, have you ever evaluated a program that was not successful, and could you share with us the reasons why that program was not found successful or not working?
I'll just start off. Those of us who do outcome evaluations are inherently pessimists.
Realist, Akiva.
So,
realist.
I think it's just important to make a conceptual distinction between whether or not a program works and whether or not we can demonstrate that a program works. So, as evaluators, we're all focused on the latter, and quite rightly so. But when you don't find effects, that doesn't necessarily mean that there aren't any good effects being had. All the things that were being discussed here can work against being able to show those effects. So we tend to worry about the way it's going to break down from the get-go. And I would say with this population, and in the context of reentry, one of the things that bedevils the situation is that we often have individuals who are returning communities with many needs, and the programs that we are able to fund or implement are only able to address some of those. So the amount of treatment that they're often, or services that they're often receiving, is often below what anybody who really knew the individual would think would really completely work. And so we're evaluating half measures in many, many cases. And I think, and those half measures may all be good in their own right, but and maybe doing valuable things, but when you think hard about whether or not giving, I'll just randomly choose something, worrying about the housing without worrying about the mental health and substance abuse for someone is going to get you over the mark, or conversely, worrying about the mental health without worrying about the housing. If either of those half measures is going to get you there, or whether you're going to need both of them at the same time, I think we have a lot of programs that are caught in that bind.
I think there's two aspects of this to follow on what Akiva's saying, and that is, I think it's really important that evaluators understand, or people who are asking for and funding evaluation, to always be cognizant of the fact that people who are providing services have to get up tomorrow and do something, and that you know, what they're doing can't live or die on the basis of whether something has been proven to be better than the thing that they were doing yesterday. And I mean, I don't know, you know, in medicine, you know, the FDA approves a new drug as long as the outcomes are equivalent to the outcomes of the comparison drug. And what we're saying when we do program evaluation is the program is acceptable if the outcomes are better. And so, I mean, I think that we need to be aware of those two things when we do this, that out there in the real world, not the research world, people are doing some things, and it may be that if the outcomes are equivalent and there are other reasons, be they cost, be they the way that you want to organize your resources, or some other structural, organizational, infrastructural reasons why it may be better for you now to do B rather than A, then, you know, surely you should go forward and do that. The gold standard for answering the question, does this work, is very gold. I mean, it's a very, very high bar, and so, I mean, I think it's always incumbent on everyone to keep that in mind as we go forth and do, you know, the next new programming, the next new evaluation, the next new federal effort.
Okay, great.
I'd like to make one quick point, that just to clarify the way the question was phrased, that I think Pam was hitting on it quite well. To find that a program doesn't have an impact doesn't mean the program didn't work. Right. And that is a really important distinction to make. You're just saying it's not better than what else exists. And that is a really important distinction, and I think it's often overlooked. Oh, this program's a failure, it doesn't work. That's not correct.
That's right. It's not the answer that you're getting.
Okay, great, thanks. So I think that we, you know, heard a lot of great information here today, and you know, if you were unable to write down, you know, rapidly everything that was going on, I just want to, you know, reassert that the PowerPoints are going to be set up on the conference site, so you should, you know, feel free to go and download those so you can, you know, reflect more thoroughly about what's going on. And I want to thank our panelists for their participation, you know, up here this morning, and everybody in attendance.
Yeah, sure. Can I clarify, the meeting in room J is for the adult offender reentry demonstration programs funded in 2010, 2011, who are part of the evaluation that RTI and Urban is conducting. So I think there's 5 or 6 sites here that are as a part of that evaluation, and we just want to meet briefly with you to talk about upcoming activities.
Please join me in thanking the panel.